So, hello. My name is Lance McCarthy, and this is my alter ego. He's slightly quieter than I am. Now, Lance spent about 18 months or so in the foyer of Hinchinbrook Hospital, meeting and greeting all of the staff, the patients, the visitors that came through the main entrance of the hospital. And hopefully over the next few minutes, you'll understand why he was so important. So I want to take you back in time to November 2015. I'd been at Hinchinbrook for about 10 weeks or so as the chief executive, and it was my first chief executive job. And the organisation had been in special measures for about a year or so, and we just had a CQC re-inspection. And I was standing at the coffee shop at the front of the hospital, and I was waiting for my coffee. And this middle-aged gentleman, slightly older than me, came up to me and said, "Excuse me, are you Lance?" So I said, "Yes." And when I confirmed who I was, he then spent about 2 or 3 minutes really calmly but really passionately telling me about the appalling care that his mother had just had on one of our medicine for the elderly wards. In terms of what I can tell you, his mother had been on the ward for about 3 weeks or so, had only been seen by a consultant twice in that period of time. His view was that the nursing care was very poor. Our communications with the family had been shocking by the sounds of things. And his mother had had a failed discharge, in the main, I think, because we just hadn't been able to get our head around completing the paperwork properly. And this was a pretty grim story, and it was really hard for me to hear as the chief executive, as a new chief executive. And levels of personal responsibility that I had for this patient, but also actually all of the hundreds of thousands of patients that we served, really struck home with me. Now, it wasn't as though I didn't feel personally responsible. I was the accountable officer after all, but it was hearing the story firsthand and knowing that I was the chief exec that really hit me quite hard. I also felt really personally responsible for all the staff as well. So in the short time that I'd been there, I'd had a lot of staff tell me how they felt about being in special measures. Some said that they were embarrassed to even work in the organisation. Some said that they'd lost their sense of pride in the trust. And there was one staff member who I can remember vividly who'd had just recently resigned as a direct result of being in special measures, despite the fact that she'd worked in the organisation for many, many years and lived within walking distance of the hospital. So I knew that we needed to do something. I knew that I needed to help and support some really big change to support our staff and our patients and our patients' families. Now, at this point, I just want to say this is not a story about me. It's not a story about heroic leadership. This is a story about how all 1,800 members of staff in the organisation embraced the unknown, worked really differently to make sure that we could really improve the quality of care that we're providing for our patients. So a couple of weeks on from the coffee shop experience, thanks to Lance, I was walking along the big long corridor at Hinchinbrook from the education centre right at the back of the hospital to the open plan exec team offices right at the front. And I was talking to staff and patients and greeting them as I went down the corridor, and thinking about all of the things that we were doing. And I got to the front of the hospital and I walked into the big open plan exec offices. And they were like Piccadilly Circus. There was absolute chaos. There was people on the phone, there was people talking over each other, there was people in meetings, there was people arranging other meetings, there was people literally running around the offices. And at that point, it suddenly struck me that the biggest problem that we had was the sheer level of chaos in the organisation. We were reacting to everything. We weren't proactively anticipating anything at all. And this was driving our decision making. This was meaning we were making short-term decisions and non-multidisciplinary decisions and poor decisions. So I spent the next few weeks with the senior management team working out, well, how do we change this? What do we need to do to bring a level of calm within the organisation as a whole? So we developed a programme called Good and Beyond. So what Good and Beyond was, it pulled together all of the different initiatives that we had running at the same time into one single programme. So it gave a central focus for everybody in the organisation to work together on. And over time, that started to reduce the chaos, it brought a level of calm, and it brought a level of consistency in our decision-making. It enabled us to be much more proactive. What Good and Beyond also did was describe to everybody internally and externally that we were on a journey. We wanted to go beyond getting out of special measures, and we wanted this continuous improvement cycle to go all the way through to get long-term sustainable changes for benefits of our patients. And the third and most important thing that the Good and Beyond did was it created a framework for us to support changes in behaviours across the organisation. Now, I strongly believe that any organisation that goes into special measures, health or social care organisation, the one big thing that it needs to do is change its behaviours and change its ways of working. By definition, if you do exactly the same thing in the same way, you're going to get exactly the same result. Now, we were doing masses and masses and masses of things differently. We had spreadsheet after spreadsheet after spreadsheet, hundreds and hundreds of different things. But if we didn't change the way that we were doing that and change the underlying behaviour across the organisation, then those changes weren't going to be embedded and those changes weren't going to be made sustainable. So Good and Beyond created this framework for us. And one really big thing that we actively chose to do as a senior team was to be much, much more open and honest across the whole organisation in all of our interactions internally and all of our interactions externally and all of our interactions with our patients and our patients' families. Now, this can come with some difficulties and can come with some problems and some issues. And certainly as we became much more open as the exec team, quite a lot of us, or a number of us, received some abuse from some of our patients. And to the extent that actually some of us started to get some real personal attacks on social media. And that's pretty hard to take, and that's pretty hard to take anyway, but it's pretty hard to take when you're working really, really hard to try and improve the care for those exact same people who are abusing you. But what that did on the positive side was really, really supported and created a big, strong sense of personal resilience. And as a team, actually a really big collective resilience. And that was one thing that really drove us onto being a really good, high-performing team. And we encourage this openness and honesty across the whole trust, across every interaction. The other thing that we did was proactively put the patient right at the centre of every conversation that we had. It might sound pretty strange that that wasn't happening anyway. We were working in a hospital, for heaven's sake. And that absolutely did in the clinical context, and absolutely still does in every clinical context. But you'd be really surprised at the numbers of meetings that I've been in over my career where the patient isn't mentioned at all. So we proactively put the patient into the centre of every conversation. As well as the external issues and abuse that we received, driving the change in behaviour also created quite a lot of conflict internally. So as staff members started to feel a little bit more comfortable with being a bit more open and honest with their colleagues and having conversations with them that they hadn't otherwise felt that they could have in the past, that created a lot of challenge and as a result quite a lot of conflict, and that became at points quite difficult to manage and took a good couple of months for that to sort of work its way through, and a good couple of months before staff felt able to fully embrace those changes and fully start to be much more open and honest with each other. But positively, that really led to a massive change in the way that we made our decisions. It led us to making much better decisions, much quicker decisions, but most importantly, many, many more multidisciplinary decisions, which were clearly the right things to do for our patients. Now, if I forward wind from there and forward wind to September 2016, so 10 months after my previous conversation in the coffee shop, and again, I was standing there waiting for my coffee. Not that I drink coffee all the time, by the way. And a separate gentleman came up to speak to me. And again, he asked if I was Lance. Now, this wasn't an unusual occurrence. So not only was my alter ego dotted about around the whole organisation, but the alter egos of all the exec team were dotted around the rest of the organisation as well. And this enabled staff, patients to feel they had the licence to come and tell us the good and the bad about the trust and about the services that we were providing. And this must have happened to me at least a couple of times a week. But this interaction really stuck in my mind because on confirming that I was the person in the poster, he then first of all, congratulated me on leading the organisation out of special measures, but then spent 2 or 3 minutes very calmly but very passionately telling me about the fantastic care that his mother had received on the exact same medicine for the elderly ward as the previous individual had experienced, very different experiences 10 months prior to that. And he was there just going to pick his mother up, and he had nothing but praise for all the medical staff, nursing staff, all the other healthcare professionals who'd interacted with his mother, and nothing but praise for the way that the organisation and the individuals had communicated with him and his family. And it was in very, very stark contrast, clearly, to the first experience that I mentioned earlier. So in the space of 12 months, the whole organisation had completely embraced the unknown of being in special measures, had completely changed the way that it was working, was putting the patient right at the centre of every conversation, was being much more open and honest, and made a huge, huge number of changes across the trust. Changes that made a real difference to the patients who were receiving our care there, and will make a real difference to the patients who are continuing to receive care into the future at Hinchinbrook. And that was done by all 1,800 staff working very, very differently, and helped just a little bit by Lance and his alter ego colleagues. Thank you very much.